welcome to our special show Together Against HPV. I'm Gargi Rawat. On the show today, a special discussion where we explore how states across India are leading the fight against cervical cancer through HPV vaccination initiatives. From being pioneers to recent adopters, these efforts are paving the way for a healthier future. Let's begin with Sri G.T. Dhungal, Health Minister of Sikkim, as he shares insights into their landmark HPV vaccination program initiated in 2018 and tells us how in just the last 6 years, they've seen a significant dip in the cases of cervical cancer. It is now our honor to be joined live from Gangtok by Sri G.T. Dhungal, the Minister for Health and Family Welfare for Sikkim. Thank you so much, sir, for joining us in this very special campaign. First and foremost, congratulations, sir, on Sikkim becoming the first state to implement the HPV vaccine at the state level. You began back in 2018 and your HPV vaccination campaign was incorporated into the state's routine immunization program. We really want to know from you what led to this, what were the conversations and the thought behind this?
Good afternoon, madam. It is nice to be with you, and it's a privilege to be amidst all the learned people here. For information, our government, which started under the able leadership of our Honorable Chief Minister Prem Singh Tamang, he is very proactive and he is very compassionate towards all the people here. We have rolled out a scheme under the guidance of the Chief Minister, and of course it's a central scheme, but it's for the aged also. But the HPV vaccines, which we had carried out in 2018, it has helped a lot because the cervical cancer was quite common here in Sikkim. So this launching of this HPV vaccines has protected a lot of girls from having this cervical cancer, because under the CASH program also, we did the screening for the cervical cancers. So when we had this opportunity to roll out the HPV vaccines, that has helped a lot and it has controlled the spread of cervical cancers to a great extent.
That's amazing. I mean, just in 6 years, they've managed to bring down the prevalence of cervical cancer. I think that calls for a big round of applause. Absolutely incredible and so heartening that, despite the odds and challenges, that clearly the government's worked very hard at this. Tell us more about that. How did you overcome the resistance from the community, tradition, mindset, taboos around this cancer and the vaccine?
Actually, see, like when people suffer, the first and foremost what people require is good health. And for good health, now when faith healers go around spreading all sorts of rumors, and then they have all sorts of misconceptions that when they try all the tricks and then when it doesn't work out, then ultimately they'll have to resort to these medical facilities and the vaccines which we had rolled out. So all these things combined together have helped overcome the misconceptions which the faith healers had, and even the local leaders and the community leaders who were a bit doubtful about the vaccine, after the results which has been explicitly revealed and they can now see around, has convinced them, and all these factors where they could see the reality and the process and the effects of the HPV vaccines, people have now considered that this is good and they should go in for that. So now it has been used and it is being used explicitly in a wide way in regard to the vaccines relating to HPV.
All right, wonderful. Dhungalji, now we do know vaccines are usually part of the national immunization program. We're still awaiting that the government will do something more on this. And that's also because of the costs that are involved in a vaccination program. So tell us, how does Sikkim sustain, support and fund the vaccination program for all the eligible girls?
No, actually, it's mainly the center, the government of India, who have been very kind to us, and whatever fund we have with the state, with that we try to procure the vaccines, and we try to use that for all the girls, especially ranging between 9 to 14 years, and that we have been doing very successfully. Of course, there are constraints in regard to funding, but then the government of India has been very kind and they have been helping us from time to time. So there's not much of issue on that.
Right, sir, and you've already seen what an improvement in women's health ever since you began this vaccine program. And vaccination is one way of fighting cervical cancer. Then, of course, there's screening. If you could tell us what are you doing in Sikkim to increase awareness around screening for women, and so that the rates will increase and potential cancers can be caught.
No, we have the mobile vans are there. Then we have health workers who are spread all over the places, even in rural areas. So they go on having doing the screening and other necessary tests, whatever is necessary, so that the cervical cancer, if they are there possessed by cervical cancer or they are affected by cervical, can be detected at early age. So when it's detected at early age, the prevention and the cure is very much there. So that's how we have been doing, and I would like to thank the health workers who have been very sincere, committed and dedicated, and they have been putting all their efforts to see that they reach out to the people wherever necessary.
And finally, Dungalji, if you could tell us what are the biggest learnings that you've had, and what would you say to, if we wanted a national level program, what could be applied to such a program from what your experience has been in Sikkim with this vaccination program?
What I feel now from our learning, we see that people have to be proactive, they have to come forward. They should not just confine themselves to their villages or homes, because whatever the government does in regard to health, it's for their well-being. So it's my plea and my suggestion and my request to all the people all over India that they should come out, cooperate with the government, cooperate with the health workers. So whatever information they have, they should not hide. Because if they hide later on, it may become a major problem, and at that time it will be too late. So a check in time saves 9, they say, no? So a stitch in time saves 9. So that adage has to be adopted. So whatever has to be done, it should be done early, and the treatment, if done early, can confine or cure the disease whatsoever.
Well, thank you so much, Shri Dungalji, for joining us on the program. And I think it's absolutely incredible to hear from the minister about how this has changed, women's healthcare there in Sikkim. Thank you so much for joining us on the program and sharing that experience. And hopefully we'll see more states and, a central program as well inspired by Sikkim's experience. Sikkim's leadership in HPV vaccination is truly commendable. Their journey offers valuable lessons for other states. Now we shift our focus to Bihar, where Shri Mangal Pandey, the health minister, tells us about their progressive step of providing free HPV vaccination for girls between the ages of 9 and 14 and their strategies for implementation.
श्री मंगल पांडे जी, हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद। बिहार वो स्टेट है जिन्होंने HPV वैक्सीन फ्री ऑफ कॉस्ट लड़कियों के लिए जो 9 से 14 साल के उम्र के बीच हैं उनके लिए इंट्रोड्यूस किया है। क्या आप हमें बता सकते हैं कि प्लान इम्प्लीमेंटेशन के लिए आप क्या प्लान कर रहे हैं और कितने डिस्ट्रिक्ट्स में?
नमस्कार। ये HPV वैक्सीन देने का निर्णय बिहार की सरकार ने अपनी कैबिनेट की बैठक में माननीय मुख्यमंत्री जी के नेतृत्व में किया है और ये निर्णय करने वाला इस प्रकार का बिहार देश का पहला राज्य है जिसने ये निर्णय किया कि HPV वैक्सीन अपने राज्य के बच्चियों को, किशोरियों को हम मुफ्त में देंगे और ये पूरे राज्य में लगभग 1 करोड़ किशोरी हमारी ऐसी हैं जिनको हमको HPV वैक्सीन देना है। और ये निर्णय हम लोगों ने इसलिए किया कि जो महिलाओं में कैंसर की बीमारी होती है उसमें लगभग 17% कैंसर जो होता है वो गर्भाशय के मुख पे, ये जो सर्वाइकल कैंसर जिसको बोलते हैं, उसके कारण होता है और उसके बचाव के लिए ये HPV का वैक्सीन दिया जाता है। तो बिहार की सरकार, स्वास्थ्य विभाग ने अपने मुख्यमंत्री श्री नीतीश कुमार जी के नेतृत्व में ये निर्णय किया कि हम अपने बच्चियों को भविष्य में होने वाले कैंसर की इस गंभीर बीमारी से बचाने के लिए HPV का वैक्सीन फ्री में देने का काम करेंगे और ये HPV वैक्सीन फ्री में देने की योजना की शुरुआत भी बिहार में हो गई है। ये बिहार के सभी 38 जिलों में HPV वैक्सीन दी जाएगी। प्रारंभिक तौर पे ये जिला सदर अस्पतालों से हम इस वैक्सीनेशन के कार्यक्रम को शुरू कर रहे हैं और फिर आगे चल के हम जो CHC हमारा है, कम्युनिटी हेल्थ सेंटर, सामुदायिक स्वास्थ्य केंद्र, वहाँ तक अपने चिकित्सकों के माध्यम से हम इस HPV वैक्सीनेशन के काम को आगे बढ़ाएंगे। और इस वर्ष बिहार सरकार की कैबिनेट ने 150 करोड़ रुपए की मंजूरी इस वैक्सीनेशन के लिए दी है। तो मैं समझता हूं कि ये एक बहुत बड़ा काम हम सब लोगों ने बिहार में शुरू किया है।
कुछ पॉजिटिव्स या लर्निंग्स आप हमारे साथ, हमारे दर्शकों के साथ शेयर करना चाहेंगे जो रेस्ट ऑफ इंडिया में अप्लाई किया जा सके?
नहीं, मैं तो यही आग्रह करना चाहूँगा कि सभी राज्य चाहें तो इसको लागू कर सकते हैं, कोई चैलेंजेस नहीं है और कोई बहुत बड़ा आर्थिक बोझ भी नहीं पड़ता है। आर्थिक रूप से बहुत ज़्यादा बड़ा राशि इसमें खर्च करना पड़ता है, ऐसी बात है। हाँ, निश्चित रूप से एक रकम तो खर्च होती है, चूंकि बिहार एक बड़े आबादी वाला राज्य है। हमसे कम आबादी वाले राज्य ज़्यादा हैं, हमसे ज़्यादा आबादी वाला 2 ही राज्य है। तो विभिन्न राज्य सरकारें चाहें तो अपने जो स्वास्थ्य सेवाओं के ऊपर राशि खर्च करते हैं, उसी में से कुछ संसाधन यदि इसके ऊपर हम खर्च कर दें तो हम बच्चियों को भविष्य में कैंसर होने से बचा सकते हैं। और कई राज्य सरकारें हैं जो कैंसर हो जाने के बाद इलाज के लिए अपने लोगों को पैसे देती है, सहयोग करती है, सहायता करती है। तो हम प्रिवेंटिव हेल्थ पे बात करें और हम बीमारी ना हो उसी पे यदि खर्च करें, हम वो पैसा खर्च कर दे कैंसर होने से बचाव पे, तो कैंसर से भी बचाव हो जाएगा और कल होके जो कैंसर के इलाज के लिए पैसा खर्च होता है उसकी भी जरूरत नहीं पड़ेगी। तो राज्य सरकारों को केवल एक मजबूत इच्छा शक्ति के साथ निर्णय लेने की जरूरत है। बाकी ये टीकाकरण कोई बहुत तकनीकी रूप से भी जटिल काम नहीं है। तकनीकी रूप से भी सामान्य तरीके से जिस प्रकार से विभिन्न टीके दिए जाते हैं, हमारी जो ट्रेंड नर्सेज हैं उन्हीं के माध्यम से ये टीके दिए जाते हैं, चिकित्सकों की उपस्थिति में ये सब कुछ होता है। तो तकनीकी रूप से अतिरिक्त कोई इसमें काम नहीं करना है, बस एक निर्णय लेने की आवश्यकता है।
बिल्कुल सही कहा, निर्णय एंड आई थिंक इच्छा जो आपने बात कही, बहुत बहुत हमारे साथ धन्यवाद हमारे साथ जुड़ने के लिए मंगल पांडे जी।
As we've seen, both Sikkim and Bihar are driving transformative efforts to combat cervical cancer. But how can these state-level initiatives be scaled to achieve a national impact? More on that after this short break. Welcome back. Scaling up vaccination drives is essential to making HPV vaccination accessible nationwide. Up next, experts discuss the strategies, challenges and innovations that can help chart the way to counter cervical cancer and improve public health. We've been talking, during this program about the vaccination drive, how important it is. We've also spoken about how in India, we're not a society that's very reluctant to take vaccines. There's a lot of awareness. There's a lot of welcoming of vaccines. But when it comes to the HPV vaccine, how do we drive that up? How do we scale it up so that we can cover more and more of our girls and women?
Thank you for inviting me. I like your action saying drive it, So that's what we need to do, because we said awareness to action was the first phase of what we were campaigning for. Now it is accelerated action. We really need to move fast, and we know that where there's a will, there's a way, because we've already proven by the general immunization program for the children in our country and as well as the COVID. So I think like Anemia Mukta Bharat had the 3 T's, test, treat and talk. Similarly, the cervical cancer elimination also has 3 T's. It's technology, it's trust, and it's togetherness. Because kill it before it kills you is the tagline. And the immense potential for technology, for everything that has been spoken on all the panels. The demand generation, the supply. The demand, yes, there are many doctors who are great social media influencers. So we have to use their potential on this particular subject of accelerating the vaccination drives through the social media, because all said and done, the doctors influencing through the social media for that right age group, 9 to 14, most certainly is expected to work. Togetherness, as is the title of this program. It's not, one person's or one cadre's responsibility. All of us are here together. Anybody, any human being on earth, it should be their ownership and their mission to say simple things like, have you taken your HPV vaccination? And then the person who has heard this can move across and ask the concern, what is it about? Why should I take it? How should I take it? Where it's available? The cost, this, that. And together we can, get the supply chain in order. We can get the Make in India manufacturing, for example. We can bring down the cost. We can do a lot of things together.
We're talking about scaling up the vaccination program. What are the challenges that you see to this? Earlier, we heard about how maybe if we did want to vaccinate every young girl in India today, what should the government's priorities be? Of course, awareness, but what else?
In 2014, WHO gave the certificate to the Government of India about the polio elimination. We have been hearing about the polio program, the success of the polio program. In 2014, WHO gave the certificate to the Government of India about the polio elimination. In that meeting in Vigyan Bhavan, Madam Sushma Swaraj ji, she had said a very, very important thing. She had said that today, on behalf of the country, we thank the manufacturers for providing us the vaccine. We thank the health workers for ensuring that the vaccine reaches the last mile. We thank the governments at the state level and the central government for the coordination. But this program success is because of the people of India. The people of India had embraced the polio program, and that is why this program became successful. So I want to state here that for any vaccination program or in terms of any public health goods, there is an acronym, and that acronym is not a good acronym. It is called the SAD acronym. And why I say this is the letters S, A, and D come one after the other. S is supply. We need to have uninterrupted supply of vaccines, drugs, diagnostics in order to scale up. We need to ensure that the population which needs it has access, and that is the A. And once we have the access, then the demand must be generated within the community. And the demand comes from the community very automatically. Because if they find that the product is useful for them, they will embrace it. If they find that it is not useful, it will be very difficult for us to really take that forward. So I want to bring here 3 T's which have driven the vaccination program in India. If we see the vaccination program, it is driven by 3 T's. The first T is technology. Over the last 2 decades, starting from the vaccine vial monitor, which was a game changer for polio vaccines, from the EVM, the electronic vaccine management, the entire EVIN, the electronic vaccine intelligent network, down to CoWIN, which we all saw how it built trust amongst the population. All of it has been driven by technology. We need to embrace technology to drive our new vaccines, including the cervical cancer vaccine. The second T is what my friend Dr. Vivek was talking about, and I told you in the story, trust. And the third T is a very obvious T, of which we have been hearing from the beginning, teamwork. This will not be achieved by the health department alone. The education department, the Ministry of Science and Technology, the Ministry of Women and Child Development, and all the ministries, including the finance ministry, will have to work hand in hand in order to ensure that this is a teamwork that moves forward.
A unified approach to scaling vaccination drives can significantly boost the fight against cervical cancer. Now we turn to a more personal perspective and understanding the human stories behind cervical cancer. We speak to a range of women who highlight the emotional and social dimensions of the disease and its prevention.
अनांसी, सबसे पहला सवाल मैं आपसे पूछना चाहूँगी, इफ़ यू कैन जस्ट शेयर योर जर्नी एज अ सर्वाइवर, आपके जो इमोशनली, फिजिकली, मेंटली, जब से आपका स्क्रीनिंग हुई, डायग्नोसिस हुई, ट्रीटमेंट हुई, अगर आप हम सबके साथ अपनी जर्नी शेयर कर सके प्लीज़।
स्टार्टिंग में जब मेरे को पता चला, मेरी एज 31 थी, मेरे को हाई ग्रेड न्यूरोएंडोक्राइन सर्विकल कैंसर था। उस टाइम पे मैं 5 मंथ प्रेग्नेंट थी, तो धीरे धीरे मेरे को प्रॉब्लम्स होने लगी। मेरे को वाइट डिस्चार्ज की प्रॉब्लम होने लगी और ब्लीडिंग प्रॉब्लम होने लगी। हमें लगा कि बेबी की वजह से ये सब चीज़ें हो रही हैं, बट वो सब नहीं था। मेरे को कुछ और ही अंदर मतलब अबनॉर्मल डिस्चार्ज होने लगा, तो डॉक्टर ने चेक किया अंदर से। देन मेरे को पता चला कि अंदर कुछ अबनॉर्मल ग्रोथ है। बहुत शॉकिंग था हमारे लिए, मेरी फैमिली के लिए शॉकिंग था। तो मेरे को समझ नहीं आ रहा था हम लोगों को। पहले मैंने सर्विकल कैंसर के बारे में कभी मैंने सुना भी नहीं था। मेरी फैमिली में किसी को कैंसर नहीं था। उस टाइम पे मेरा फैमिली सपोर्ट, मेरा हस्बैंड ने काफ़ी सपोर्ट किया। उस टाइम पे मेरे को 29 रेडिएशन और 6 कीमोथेरेपी और 3 ब्रेकीथेरेपी दी गई, जो काफ़ी मुश्किल था मेरे लिए। मैं एकदम घबरा गई थी उस चीज़ से। मेरे को पता नहीं चल रहा था कि मेरे साथ हो क्या रहा है ये सब चीज़ें। तो अभी आई एम फाइन। काफ़ी मतलब मेरे लिए थोड़ा मुश्किल थी वो सब चीज़ें हैंडल करना। मैं एकदम स्ट्रेस में चली गई थी। तो मेरी फैमिली ने मेरा सपोर्ट काफ़ी अच्छा किया। उन्होंने, हस्बैंड क्या करते हैं कि इतनी बड़ी बीमारी सुन के सोचते हैं कि छोड़ देते हैं, साथ छोड़ देते हैं, बट मेरे साथ ऐसा नहीं था। मेरे हस्बैंड ने मेरा पूरा सपोर्ट किया, मेरे इन-लॉज़ ने मेरा सपोर्ट किया, जिसकी वजह से आज मैं यहाँ पे आप लोगों के सामने अपनी जर्नी शेयर कर पा रही हूँ। मैंने अपने 5 मंथ बेबी को अडॉप्ट कर मतलब खो दिया उस चीज़ की वजह से। आगे भी मेरी फैमिली ने सबसे पहले मेरे को चुना, और वो अब मैं आगे प्रेग्नेंट नहीं हो सकती हूँ, फिर भी उन्होंने ये बोला कि हमें कोई और नहीं, बस तुम चाहिए। मतलब मेरी फैमिली
सपोर्ट
मेरी काफ़ी सपोर्टिव है, उनकी वजह से ही मैं आज आप लोगों के सामने हूँ।
You've devoted, many decades. I mean, your work has been on the elimination of cervical cancer. What are the most important findings, and how do you think women can prioritize? We've been talking about reproductive health, that we don't want to talk about it. How do you think that shift can happen, and what have you really found in all these years?
Now I think a lot more is spoken about cervical cancer these days than was before, but it's probably still not enough. And the important thing to note is that it is such a tragedy because it is preventable more than any cancer. When we talk of breast cancer, we talk of early detection. But in cervical cancer, it's the true prevention, because we know that it's caused by an infectious agent. As we have in the case of liver cancer, we have hepatitis, so here we have HPV. And we know that we can prevent that by a vaccine. We know that we have a long precancerous phase which we can detect. I'm really grateful to Nancy and Vanna for sharing the stories, and Nancy has told us how she was symptomatic, but actually if you go into the precancers, it's not even symptomatic, and you can detect it at that stage, treat it, and never reach the stage of cancer. So it is a tragedy, undoubtedly, if this sort of thing happens. And the important thing also to realize is it's a pyramid, because a lot of women will get HPV. They feel guilty sometimes. We heard about how husbands may accuse them of maybe having got them from some outside relationships. But the fact of matter is that 85% of women and 90% of men are going to get this infection at some point in their lives if they are not going to be vaccinated. And it is only about 10% of them who will not be able to clear the infection but at this point in time, science cannot tell you which 10%. So 10% will continue to have the infection, and out of them a proportion will develop the precancer, and then they will go on a very small proportion to cancer. We do worry about cancer, but I can say to you that the precancer is no less a problem. And we see, particularly now with the increasing age at marriage and childbearing, and then they go to the IVF clinic and they're diagnosed with a precancer. And now the whole thing is shifted from being a discussion about how they will get pregnant and have the baby, it becomes a discussion of how they will manage the precancer. And not everyone is as lucky as Nancy has been. And there are many relationships that cannot stand this stress and they break up, and there's mental problems and guilt and so many things, depression and other things that they go through. So to me, it seems important not just to worry about that endpoint of cancer, but to worry about the quality of life with all the previous stages, to worry about not getting the precancer, to worry about not getting that infection at all and having to deal with that positive report.
Absolutely.
Hearing these stories reminds us why the fight against cervical cancer is so critical. By combining personal advocacy with state-led action, we can bring about lasting change. Together with awareness, action and compassion, we can create a future free from this disease. Stay tuned to NDTV for more such impactful stories. Thank you so much for watching. Goodbye.